Hi guys. So while we wait for Instagram to tell all of you that we are going live, hello everyone. So we are celebrating National Breastfeeding Week, and this is why I have a lactation counselor with me who will help us understand what the new mothers should be doing. Incidentally, the moment I put out this post saying that we're going to be going live and talking all about breastfeeding, we had huge list of questions that the new mothers were struggling with. So today we're going to be talking about all the questions, and I just see another new mother joining in. So let's just get started. I am going to invite Vidyashri to just join us, and that there is no technical glitch, because the last time when I went live with my Ayurveda doctor, we had a lot of technical glitches, and I'm sending an invite, but it doesn't seem to be going. Okay, I can wave to her, but not send her an invite. I don't know why Instagram does that. Guys, sorry, just wait for a minute while I deal with this technical glitch as always. Okay, let me see if I can. Vidyashri, can you please send me the invite again? Let me just cancel this, and so that then. All right, I see Vidyashri with me. Hi, Vidya. Good
Hey.
morning. Good afternoon.
Good afternoon.
Hi. Welcome
Hi.
to our Insta Live, and I'm so thrilled to have you here because I know a lot of women are going to benefit with this. So, for everyone who's with us right now and who would be listening to this, I would like to introduce Vidyashri. Vidyashri is based out of Bangalore. She's a lactation counselor who helps all the new moms clear out all their confusions, help them feed their babies in the best possible manner, also maintain sanctity for themselves. So here we are. So Vidashri, I was just telling all the viewers that as soon as I put out this thing, that I'm going to go live with a lactation consultant, we had a lot of questions, and I have listed them down, and we will get started. Meanwhile, do you want to give us a quick background as to why did you choose to be a lactation counselor?
So, am I audible?
Yes, you are.
Wonderful. So, hi, everybody. So, I'm a lactation counselor, a birth educator, and fitness instructor. So, the reason for choosing lactation consultation is that, there are a lot of struggles, and it's a long time journey. It's not a short thing. It's not a one day thing. So, and it involves a lot of nutritional aspects for the newborns, and the moms are also going through a roller coaster right after birth, right? Like we go through a lot of tough time post delivery. So it means a lot to be helping the moms and the kids once they are starting this beautiful journey of breastfeeding. So that interests me, and I would like to contribute more in this field.
Awesome. So, of course, my kids are now grown up, 17 and 15. But when I delivered, and especially the first time, oh my God, I used to get panic attacks, and lactation counselor wasn't a very normal thing then. But looking at my panic attacks, looking at my anxiety, my gynac, introduced me to one, and I can't tell you how helpful it was. I would just reach out to her, and she was able to tell me, calm down, your baby is getting enough milk. So, and my first question used to be, how do I get my baby to latch properly? And that's the first question, because you the first time mom. And I still remember that hilarious scene in the hospital where I didn't know how to feed the baby. And my mom was sitting there and laughing. I was almost on the baby trying to feed the baby, and my mom said, "You would choke the baby." So, you know, so, one follower has asked, how can I get my baby to latch properly and comfortably?
Okay, that's a good question. So we all know how to latch, but then the problem is like getting a comfortable latch, getting a deep latch is a challenge. And
Mm,
like positioning is so very important, and handling the baby is very important. The way you hold the baby. Okay, there are a lot of touch points involved, and I would like to bring up the common mistakes that
mm,
new
mm,
moms make while latching. Rather than we all do it, but there are some mistakes that generally I observe during my consultation. Okay, once they are showing like this is how we feed the baby, there are a few points that they have to change. So the first and foremost thing would be the baby's head will be tilted to one side, the rest of the
Oh,
body
you
will
have
be
a baby. So sweet. All right. Demo baby. Yeah. All right.
yeah.
Yeah.
So like the baby's head will be turned towards the mom, but the chest and the abdomen, everything will be looking up at the ceiling,
Mm,
right? So it's not an ideal thing to do. Once the baby's head is only turned towards the mom, like when they are holding, they just hold the head and turn. Okay,
mm, mm.
so the rest of the body should also be aligned. So, for example,
Ah.
once they are turning, they have to make sure the rest of the body is also properly rested. Like once the baby is really fussy, after 2 or 3 minutes of latch, it's not comfortable. Okay,
Mm,
so you have to immediately check their hands and their leg position. So if it's hanging, right?
mm,
So their
mm,
legs are hanging somewhere and the body is twisted, okay? And
mm.
the head is towards you. So what happens? Like it builds up a lot of tightness around the baby's body, okay?
I mean, imagine
And
ourselves, we won't be comfortable in that position as well.
exactly,
Right. Yeah.
exactly.
Yeah.
So we will not be liking to drink something by turning our head like this, that too for like half an hour, 40 minutes. No way,
True.
right?
True.
So the babies
Yeah.
can't communicate, then they become really fussy at the breast. So one thing that they
Mm,
have to make sure is that their ear, shoulder, and the bum, everything should be in straight line.
mm.
Okay,
That's a very
and
nice tip. Yeah. Yeah. Very handy one.
yeah, every single time they have to make sure that the baby's body is well aligned and the baby's tummy is on the mummy. So that's yet
Mm.
another rule.
Ah, okay.
The chest and the tummy should be on mummy.
Mm. Tummy
Okay,
on mommy. That's a nice saying as well.
so
Yeah.
that's how the baby should be positioned, and the baby should be very close to the mom. And one more point is like they will start the sucking reflex even before they open their mouth.
Mm, mm.
Okay, so they will insert the nipple into the baby's mouth. So I'll have another model for you. Okay, so they'll be
Good one.
so imagine this is the baby's mouth. So the mom directly goes and inserts the breast.
Mm,
So what
mm,
happens like even before the baby opens its mouth wider? Okay, so what will be the impact of baby not having its mouth wider would be like they'll be just suckling on the nipple and
mm,
they are missing out on larger part of the breast or the areola.
mm.
Okay, so
Okay.
which
Okay.
hits the transfer of milk in turn
Mm, mm.
and sucking
But
just
what do
on.
we do?
Mhm.
What do we do if the baby refuses to latch?
Okay, okay, so baby refusing to latch. First, make sure that the root causes are analyzed. Is it like always or once in a while? So there may be many reasons why the baby refuses to latch. Okay, for example,
Okay.
like if you go month-wise, initially as a newborn, the baby might be refusing to latch because the breast will be might be really hard.
Mm,
You know, like there is an engorgement problem where the breasts are super hard. Okay. And then what happens on a very hard breast, which is not soft, the latching becomes really difficult for the baby. Okay.
mm. All right.
So they might pull away or reject or become fussy. That might be one reason. So from the kid's perspective, they might be having stuffy nose or a nose block. Okay. So
Mm,
like they will pause in between and they will breathe in between the feeds, right?
Okay.
They suckle, they pause, they suckle, they pause. So what happens if they are if they have to pause and breathe and the nose is blocked, they will not be able to. So they have to unlatch themselves from the breast, take a breath in, and then again go and relatch.
Okay. Okay.
Okay?
And a lot of newborns have jaundice at birth, right?
Right,
Within few hours or maybe a day or so.
right.
So does that also affect baby's feed or the way they latch? Does that affect?
Definitely they do. Okay,
Mm-hmm.
so the common mistake that parents make or like they don't know about is that like jaundice babies tend to sleep longer and they are not pretty much active. Okay,
Mm-hmm.
so they will not be waking up every 2 hours or 2.5 hours and ask for feeds. So as new parents, like these people think that the baby is sleeping and we should not be disturbing them. So, and another misconception is that like once they are hungry, anyways, they are going to cry and they are going
Mm-hmm.
to ask for
Right.
milk.
Right.
Okay, so but then the baby is already having jaundice. So they are drowsy, they are sleepy, they are tired. Okay, so those babies will not be active and will not be coming to breast quite often. So it's the
Mm.
new parents' job to feed round the clock. Make sure that the
Okay.
baby is getting enough.
So is 2 hourly feed a good enough interval?
Yes. So 2 hours. What I mean by 2 hours break is that end of feed from that the next feeding cycle. Like
Next
12:30
2 hours.
the feed ends, then the next feeding cycle would be 2:30.
Ah, all right, that helps. Now, one question which I always had, and a lot of mother had, is
Okay.
my milk supply enough for the baby? Because we always think, oh, bichara bhuka hai, did he get enough milk? Did she get enough milk? And we're always anxious about this. How
That's
do we
right.
know this?
So like two important factors for finding out if their baby is getting enough or not is with their output. One is their output, P count,
Urine output?
urine outputs. Are they urinating enough? Okay.
Hmm.
So from 6+ days onwards, like we are expecting a bare minimum of urine output per day.
Okay.
Okay.
6 times, is it?
Minimum of 6 times, yes.
Okay.
Okay. So, and it goes on by like the newborn, as a newborn, we are expecting 1p. Day two, we are expecting 2p count. So, and it continues. And fifth day and sixth day onwards, we are expecting a bare minimum of 6p counts. Okay.
Okay.
So, that is one factor. If the baby is peeing enough, if the output is good, which means that they are good in transferring the milk and they are getting enough.
Hmm.
Okay.
Okay.
And then another thing is like the baby's weight gain. So we are expecting at least 200 to 250 grams per week.
The
Okay,
weight gain.
so a weight gain of 200 to 250 per week, and
Hmm.
approximately in a month we are expecting 1 kg of weight gain.
Right.
Okay,
So those are
so
two signs, huh?
two critical signs that the baby is getting enough and you are producing enough.
Sometimes, the baby cries, and the moment I get or the new mother, gets the baby closer to latch, the baby is quiet, and the moment you remove, again the baby cries. Is it more for comfort or the baby is hungry?
Like,
The
I'll repeat the
moment
question.
you
Like,
the moment you remove the baby away from the breast, the baby starts crying again.
okay,
Yeah.
yeah.
So is it more for hunger, comfort?
It's more of a comfort thing and the
Mm.
feeding duration. So if it is doing at the end of the feed, like around like after 20-25 minutes of feed, okay, so and you're releasing the latch and the baby is crying,
Mm.
okay, so it's more of the body warmth is gone, the sucking
Mhm.
comfort is gone, right?
That leads
So,
me to my next question.
mhm.
How long and how often, of course, you address that every 2 hours, but how long should a mother feed the baby?
Okay, so the feeding duration also depends on the month. So as a newborn, we recommend feeding for 20 to half an hour, 20 minutes to half an hour.
20 minutes
Okay,
to half an hour.
20 minutes to half an hour. And feeding for 1 hour, 1.5 hours is not recommended. So
Okay.
I
And
had
this is
seen,
sorry, go ahead. Go ahead.
yeah, I had seen moms feeding for like 1 hour, 1.5 hours. So like the new parents should be mindful of their wake window as well. So it's
Mm,
like as much as feeding is important, their nap time is also equally important.
right.
So if they are going beyond their wake up window, so
Mm,
their awake window, and they are keeping the baby suckling on their breast for like 1 hour, 1.5 hours, they are compromising on the baby's nap cycles. So
mm.
that
And
leads to
should
overtiredness.
right. And should they alternate the breast while feeding, or should they use both the breast in one feeding itself?
Like I would recommend sticking to one breast per feed.
Okay. Okay.
That's because there's a concept of foremilk and hindmilk. Okay.
Mm.
So
Right.
the foremilk comes first, and the hindmilk is where the baby gains weight and they sleep longer. Okay.
Okay.
And they are satisfied with their hunger thing. All those things are there in the hindmilk. So the
Mm.
mistake that few make is that like they feed on one breast for 15 minutes and then they switch. So what happens generally, the baby gets, it feels like the baby has fed for like almost half an hour, 40 minutes. Okay. And they have solidly spent that solid time of 40 minutes feeding. But
Right.
then the result is that the baby has got only watery milk and they haven't got into the hind milk part. So
Oh, right. Yeah.
this is the tricky part. The thing is like the baby will pee enough and the problem is the baby will not gain weight.
Ah, right. That's an insight. Yeah.
This
Yeah.
This is very important, and many moms even go to depression after going to pediatrician visit by listening to the pediatrician like the baby isn't gaining weight. Like, and the
True.
parents will be like, but then the baby was peeing all the time, like 12 times, more than 10 times. Like,
Right.
so did my mother, did my baby did not get that milk? What has happened to all the time that I
Mm.
have invested, time and effort that I have invested, right?
Right. Right.
So, like, so I don't want moms to get into depression. Please keep an eye on baby's weight gain parallelly. Okay, it's not just feeding and peeing. Okay, it might be a little misleading if the baby is just peeing and not gaining weight.
Right.
So
Right.
there is a imbalance between and fore milk and hind milk.
Hind
So make
milk.
sure
Right.
that the baby is fed also the hind milk.
Right. That was very nice. Now, this is a question which is related to today's time where both the parents are working and, most of the women are working. And of course, when I delivered, the maternity leave was only 3 months, unfortunately. And now it is, of course, 6 months.
Oh
But
yes.
then, people do continue to feed till the age of 1. And the worry is now that I'm going to go away for work. How do I express in store? Trust me, Vidya, it was a circus for me. And I said no. And so, the route that I took, I used to get back in between. Fortunately, my office was close by. So I would get back, feed my baby, and go back. Because, for me, expressing and storing was the most horrible experience. I don't know if I was doing it
Mm,
wrong or the pump
mm.
was not right. I don't know. But,
Right.
a lot of women have this question, and it'll be nice if you tell us.
Sure. So if you are planning to join an office by around 6 months, okay, luckily it got extended now and the baby will be on solids as well. Okay, not primarily on milk.
Hmm.
And then, as you said, like taking a break from the office and visiting in between can be an option if you are staying
Hmm.
nearby. If
Right.
not, just talk with your employer, okay, and check if there is a space for pumping.
Okay.
Okay, it's not hygienic to get inside the restroom and pump. It's
True.
not
True.
good. So even before joining, drop a mail to your HR team, drop a mail to your colleagues and check if there is an option, if there is a safe space where we can go and pump and store our milk.
Okay.
So alternatively, you can ask for work from home option or flexible work options that they
But
can opt
are
for.
there any right ways or wrong ways to express in store?
So, like the flange size should be proper. Like you told, no, there is not much like, and you were having a lot of trauma because the pumping style wasn't that perfect,
Correct,
right?
correct.
So the flange size, the part where you attach to the breast, no, so that has to be of the right size. So
All
if
right.
if that is causing a lot of nipple trauma, then obviously nobody is gonna like it. Right? So it's so very important that you choose the right flange.
All right. All right. Okay. And one of the viewer has asked this question saying that my baby is just 7 weeks and the baby prefers to latch onto only one breast and feeds comfortably on the one, the preferred breast. For the other one, she has to express and store and then feed. Is it normal to have preference or is she doing something wrong?
So it is it is normal to have preference, but that should get away with time. Like with 1 or 2 days, if it is going off, it's fine. But then she is only feeding on one side and the next side she is not even able to feed. Then
Yeah,
that's a
so she's
concern.
storing, she's expressing and storing. So, what can be some handy tips that she can try?
So the things that she can try on her own is like switching between positions. If she is using cross cradle as a technique, okay, so she can try football or side lying. Okay, so
Okay, you have to
try a
explain
way.
this. What is a football or a sideline for her
Okay,
to
there
understand?
are so there are various positions that you can hold the baby. Okay, you can
Okay,
hold the baby in the front, you can hold the baby to your side. Okay, you can lie down and feed. You can, this is the laid back where your baby is on the mummy. So like you
okay,
can choose different positions and see if any of the position is making a better latch than the other
okay.
one.
All right.
Okay,
All right.
that she
That helps.
can try.
Yeah, yeah. And of course, as all the women worry, how can they manage breast engorgement and prevent the plugged ducts?
Yeah, I'll get into this. Before that, like if she is continually feeding only from one breast, I would recommend her to check with a healthcare provider or a lactation consultant and get it assessed in person. So,
Okay.
like if there is any other thing that can be correct, there are a lot of other things that we assess,
All
right?
right.
So we can assess and help them.
Sure, sure, sure. I'm sure she would have taken a note of that. And if in case she needs some more help, she can just ping you. She can reach out to your Instagram handle.
Any lactation consultant would work.
Counselor.
So
Yeah.
they can
All
get to
right.
any healthcare provider or lactation consultant for help.
Sure, sure.
Yeah,
So, yeah, so we were talking about breast engorgement and, prevent plug ducts.
right. So breast engorgement is something like that happens in the initial days, okay,
Mm-hmm.
where the milk starts flowing and the breast become hard. So
Right.
later it stabilizes and it becomes normal. So the how they can manage is like once it is hardened, like before feeding the baby, it is better to soften the breast by putting hot packs, using massages. Okay, so
Mm.
like when they soften the breast, it's easy for the baby to latch on. Once the baby is happily latching on, then the milk transfer effectively happens.
Okay. So, is
Okay,
it happening because there's oversupply of milk?
so it can't be tagged to always an oversupply.
Okay.
Okay, so this is a very common thing that most moms go through,
Okay.
engorgement in the initial phase. Okay,
Okay.
so yeah, and plug ducts on the other hand is a lump on a specific area. Okay,
Hmm. Hmm.
so there is another model here. So if you bisect the
You're
breast
full
and
of
see,
models with them. Yeah.
okay,
All right.
so you have a lot of milk ducts here.
Hmm.
Okay, so
Right.
once you bisect and see, you see a lot of ducts. It's not from one tube that you're getting the milk. Okay.
Right.
So, and once you're feeding, one of the ducts might be blocked. So, for
Ah,
example, so this is
okay.
blocked. Rest all is emptied. Okay.
Okay.
So, like massaging that particular area, breast compression, hot packs, okay, and choosing a different feeding position. So, for example, if the baby has been fed from the front side, you're switching to the
Mm.
side and feeding on the same breast, okay,
Okay.
and along with that, you're using breast compression and hot packs and massages. So that's gonna help clear the ducts,
All right.
blocked ducts.
Oh, that's so helpful. And then as the child grows, the anxiety as to how can I manage frequent feeding, during the growth spurt. Because the child's going to grow, and at least typically till 3 to 4 months, we keep them exclusively on breast milk.
Right.
So, how can we do this and how can we manage the cluster feeding phases?
Okay. Okay. So we have questions in two different things. One is the cluster feeding, and the other one is the growth spurt or the milestone period, right?
Right, right.
So, like talking about cluster feeding, this is nothing abnormal. Okay, this is part of the journey, gonna be there. Okay, and cluster feeding is a term used to frequent short feedings. Okay,
Mm,
so the
mm.
baby is fed within half an hour, again the baby is crying and takes a feed again. Again, it goes on for
The
like 10
cycle.
minutes, 15 minutes. It's on a loop. You keep feeding the baby straight, okay, with shorter breaks. Okay. So cluster feeding generally happens in the evening time.
Okay.
Okay. So if if it is happening, like it's gonna happen during evening time because like you are tired, your baby is tired, the milk flow decreases during evening time and night time. Morning it's like more of watery and the quantity is more. Evening and night times it changes in the quality. So it's more of
Mm,
thick milk. So the quantity reduces. Okay. So these factors contribute to cluster feeding. Naturally, it
right.
happens across the globe. You are not the only one. Okay. So except the fact that the baby is gonna feed frequently in the evening and night time. Okay. So what you can do, set up the space properly. So where you have a proper rest for your back. Okay. So you have a TV or some entertainment going on. Don't stick to one corner of the house. Okay.
Mm,
So having snacks nearby, having water nearby. Okay.
mm.
So make yourself comfortable and be prepared to sit there for longer hours and try different feeding positions again.
Right, right,
So
right.
if a laid back feeding helps you to rest a little more longer, go for it.
All right. Yeah, that could be
Okay.
a helpful thing.
Yeah.
Now, of course, we've talked about mother and the baby. How can the whole family, the husbands or the extended family or the mothers around, how can they chip in? How can they help ease out the anxiety or ease out the physical stress that the mother's going through in this phase?
Wonderful question. Wonderful question. So the thing is like we need a village to raise a kid, right? It's not a one person's
Absolutely,
job. It's definitely not a
absolutely.
one person's job. So the thing here is like right from the education. So if they are attending a webinar, the mom is
Mm,
attending a webinar, like I would recommend the partner also accompanies her and learn.
mm,
So what are all the challenges? What will be the difficult part? Where they might go wrong? Okay. So what are the myths around that? So like getting to the webinar as a family is one step forward. Okay. So basically they at least know the challenges that she is gonna face. Okay. And
mm.
the other thing that the partner can do is like once if the mom is feeding, he can take up the burping thing. He can
Ah,
change the
right.
diaper, right?
Mm.
So frequently we have to burp the baby. We have to keep the baby upright. So the father can do that, and
Yeah.
he can change the diaper, right? He can put the baby to sleep. Another skill, at another critical skill where most people go wrong. So they know how to feed, they don't know how to put the baby to sleep.
True.
So
True.
it's like I put the baby to sleep, and then in half an hour, like we are again back to feeding, ma'am. Like we don't know what to do. So
Correct. 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 Yeah.
like they're super confused, like whether they have to go ahead with the sleeping or they have to continue feeding. What's really happening with the baby?
Hmm.
So like there are a lot of things as a family that we can help the new mom with, right? So
Right.
massaging her back, so putting a massager on her back. There will be a lot of aches and pains, right?
Hmm.
So
Right.
feeding the mom while she is feeding. Yet another
Yeah,
thing.
so
There'll be
true, no? Because while the woman is pregnant, the whole attention is on her, her attention and the family's attention. But the
right.
moment she delivers, it's just, she's all over the place because she's not able to get sleep properly because of the baby, because the baby is waking up, and everybody else is more attentive towards the baby. So I think doing these things are going to be so much more helpful for the new mother.
Right.
Yeah.
Very true. Very true.
Right. Any other tips that you would like to share that can help the new mothers?
Um, like the common thing is like they should be knowing like the feeding duration and their wake window, how to burp the baby, how to put the baby to sleep. Okay,
Hmm.
so like trying to analyze the root cause, like rather than getting the fear that the baby is rejecting my breast. So
Hmm.
analyze why. Like, is there any issue? So it's not always the low milk supply, right? Like there might be a number of other reasons. The baby might
Right.
be gassy, the baby might be having a blocked nose, or like it's not always with the mom, right?
Hmm.
So
Right.
try to look at your baby and figure out what things can be done better so that the feeding can be taken smoothly. So
Right.
nothing works, and trying to sort things on their own, like seeing lots and lots of YouTube videos, right? So you can do that, not at all a
Yeah.
problem, but then don't go too much into it. Like get
Hmm.
some help. Like don't hesitate to ask for help. This is a very
Ask
long
them.
journey, very,
Right.
very long journey, and it's like full-time job, 24/7 job. So
True. True.
it
Absolutely.
so the earlier you seek help and sort things out, the better will be your journey.
Right. Right. I think so. These were
Yeah,
my questions, and you've answered them brilliantly. We're all
thank you so
grateful to you for taking
thank
time
you so
out and
much.
doing this
Yeah,
because so many people would benefit from this.
definitely,
Um,
definitely, Nidhi. Yeah, and I would like to ask you, like from the nutritionist perspective, like
mhm.
what moms can do to increase their supply.
Okay, yeah. So that's a question that I get to hear all the time. So one is taking care of their nutrition through their
Okay.
pregnancy journey. So when I meet mothers who are planning to conceive, I tell them that pregnancy is a journey. You have to prepare your body for it so that your pregnancy is smooth and then your breastfeeding is, smooth. Now,
Hmm.
obviously, earlier there were a lot of myths saying you have to eat for two and this and that, which is not true. But while you're breastfeeding, because you are producing that milk, you need to consume about 500 calories extra, but from the nutrition rich sources. And we have something called galactagogues, which are
Hmm.
basically food sources which helps you to increase the milk supply. So, for example, we have edible gum, right, which is also called gold. So, typically in North India, right after the delivery, the mothers would be given either a panjiri or laddus, which are made with wheat, dry fruits, nuts, and lot of edible gum and ghee. So that is good fat, good protein, and complex carbs. So that will, of course, help you with milk production.
Hmm.
Also, you have to make sure that your meals are balanced, which means there is protein, there is good fat for you to be producing good amount of milk. And certain things that can really help is garlic,
Mm-hmm.
cumin seeds, methi dana. So either, add a lot of zira tadka on your dals, in your sabzis, add a lot of garlic to your sabzis, to your gravy. So that helps. Apart from that, also make sure that the new mother is hydrated. You know, women or the families would always focus on food, 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 forgetting that hydration is very important. So I tell all my new mothers to drink a glass of milk or water. Of course, water every time before they feed. A glass of milk
Mm,
every time, sorry, a glass of water before they feed, and at least 2 glasses of milk through the day
right.
you know so a balanced diet, lot of green leafy vegetables, lot of dal. If you are a meat eater, then at least 3 times a week you should consume good quality chicken, eggs on
Mm,
daily basis, so that the hind milk that we talked about, the quality of the milk is good and the supply. Now a herb called shatabri is also very good to supply, increase the supply
mm-hmm.
of your breast milk. So Shatavari is now available in the form of powders, in the form of capsules. So you can mix Shatavari powder in your milk and consume that. And apart from that, adequate rest for the mother. Very, very important. If the
Right.
mother is not getting enough rest, not getting enough sleep, the milk supply also gets hampered. So these are the things from nutrition perspective that
Wonderful.
a mother should always keep in mind. Yeah.
Wonderful. Wonderful.
Yeah. So
Okay.
it's been an absolute pleasure having you on the channel, and I'm sure so many new mothers are going to benefit.
Oh,
Uh,
thank you
yeah.
so much.
So
Same here.
thank you. Yeah, thank you.
Yeah,
And we would save this live on both of our handles so that whoever
sure.
wants to come back can come back and listen to it.
We'll do that.
Yeah. Thank
Yeah,
you
sure.
so much. Thank
Thank
you,
you.
Vidya. Thank you guys for tuning in. Bye bye.
Bye bye.
Thanks. Bye.
Bye.